what are the key elements of a press release if a healthcare professional is looking out to disseminate that will create a good press release?
So I have worked with a few thousands of doctors usually. The first thing is doctor has a story in his mind, but he's not able to translate that into a proper attractive press release. So many a time they get into that trap, beating their own trumpet in the press release. So that is the first thing a doctor healthcare practitioner should avoid. To communicate a message to their readers which talks about the essence of that particular disease or particular procedure, how they are benefiting. Doctors come with the perspective that the end result should be that I am the best, and whereas the media and the people and the readers are looking at the perspective that what is useful for me in that. Rather than saying I am Dr. X and I am the best eye surgeon. So that is something that happens, and that's why a lot of press releases they fail, they flop, they are not able to fly with the media, and that's why a lot of media have built up a perception that doctors' press releases are many a times not what they want it should be, so many a times it goes into the trash.
हेलो एंड वेलकम टू दी हेल्थ प्रेसो लर्निंग अकेडमी। आज हम बात करने वाले हैं हाउ हेल्थ केयर ब्रांड्स एंड डॉक्टर्स कैन अंडरस्टैंड द पावर ऑफ अ प्रेस रिलीज। और इसी को डिस्कस करने के लिए मेरे साथ है आज डॉक्टर स्वदीप श्रीवास्तव, अ मैन हु नीड्स नो इंट्रोडक्शन, हु हैज़ स्पेंट 25 years in healthcare media building the PR especially for the healthcare brands। एंड आज हम उनसे डिस्कस करेंगे हाउ कैन द डॉक्टर्स, द हेल्थ केयर ब्रांड्स एंड अदर हेल्थ केयर प्रोफेशनल्स कैन लीवरेज द पावर ऑफ प्रेस रिलीज। डॉक्टर सुदीप, वेलकम, थैंक यू सो मच फॉर स्पेयरिंग टाइम। तो लेट्स स्टार्ट फ्रॉम द बेसिक्स के जो प्रेस रिलीज होता है स्पेशली एक हेल्थ केयर कॉन्टेक्स्ट में, वो क्यों इम्पॉर्टेंट होता है और कैसे बनाया जाता है? वाई इज इट सो इम्पॉर्टेंट स्पेशली इन द हेल्थ केयर कॉन्टेक्स्ट?
Thank you, Kanta. Thank you for giving me this opportunity. Yes, this is what where I started my career with as the chief PRO with the Prasthapur Hospital, launching that hospital to the world in Delhi. And what I realized there that definitely there is a big communication gap between the healthcare providers, the doctors, and the media. Media at that time was quite evolving. There were no dedicated health media. That's why we created a group called HEAL, Health Assist and Authority, to do that capacity building that dedicated health journalists come up in India. And that's what happened from year 2000 till now, in 25 years. We have been part of the journey of a lot of health writers, health editors, health pages, coming in a dedicated way in all media across, and starting from traditional media to health programs on health shows to the digital media, now giving special space to the health content and propagating health content. So there, in this communication gap, press release definitely becomes one of the most important.
Right.
And it's very abusable press release, but at the same time we have to understand that without press release, that's the starting point. So if there is a hospital, there is a healthcare brand, if there is a doctor for that matter, healthcare provider, everybody starts their communication with a press release if they want to connect to the media. It's the same like first impression is the last impression.
Right.
So in anybody's communication journey, whether it is healthcare or non-healthcare, the communication journey connect to the media, media relations, public relations, everything starts with the press release. So you have to be very sensitive, very careful about the press releases, what needs to be created, how it needs to be created, what content needs to go in those press releases. So this is a very specialist area, and when particularly when it comes to healthcare, this becomes more specialized area because healthcare related press releases directly connected to health education. Health awareness and patient education.
Right.
So that's why, and there is an added responsibility in health related procedures. The whole burden of the perfect or the accurate health communication, health education, patient education lies on that small piece note of 250 words, 400 words, 500 words, whatever it is, lies on that press release. So the press release in healthcare, I would just like to very strongly put this forward that the press release in healthcare is first, it is the first connect tool to the media and to the in the field of communications, and it is not only the first but most important tool. In healthcare, it comes with a lot of responsibility. So in general non-healthcare, whether it is any product launch, any other consumer related communication, any other center related launch, anything which is non-healthcare is something where you can play with the press release by twisting. Maybe 100% facts and accuracy is not there, but in healthcare it comes with that responsibility of 100% accuracy. And the ethos behind that press release, that it is meant for improving the healthcare of any individual, any reader, any viewer who reads that. So that's why it is very important to have that first level right in terms of the right press release.
Right press release. You mentioned 2-3 very key words: specialized, and you mentioned the word responsibility. When we talk about doctors, why should they even consider writing a press release or getting a press release drafted? Because when the doctors are practicing, or the healthcare professionals are practicing, or they're trying to build their practice in this digital world, fast-paced digital world, I would say, why should they even consider?
See, for that you have to understand the overall healthcare industry and healthcare ecosystem. So healthcare industry is divided into two parts. One part of it is to do with products and medical devices, the pharma products, the consumer healthcare products, the FMCG products. Mostly the majority of it is the driven by pharma, biopharmaceuticals, and medical devices, and then comes the nutrition and the consumer healthcare and FMCG products. So that is one category of it. Second category, which is the largest category, is of healthcare delivery. That is driven by the hospitals, the healthcare providers, the doctors, and the other associated services like laboratories, radiology, and all other things associated, pharmacy, everything associated. So, looking at the larger part, that is healthcare delivery. Healthcare delivery, if you look at the guidelines in India, advertising and promotion guidelines in India, so healthcare delivery is not, even for that matter pharmaceuticals, they are not allowed to advertise directly for any of their products, their services. They are not allowed to make claims through advertisements. So that is one of the biggest restrictions. So if you open up a hotel, you can, or restaurant, you can give n number of advertisements, promotion stories, everything you can give. But when it is a hospital or a clinic or a diagnostic, there are certain regulations from ASCI as well as from the National Health Commission, wherein they cannot directly claim about certain things. Like a hospital can advertise about the launch of their hospital, that they have come at this place. So this is their place where they opened this hospital. They can talk about any doctor movement, that this doctor has joined us. But they cannot talk. They can talk about any new technology which is come up as a device. But they cannot talk about. They cannot advertise about the best surgery, the best doctor, or best anything. So that's where, and same applies with pharma also in a big way, wherein pharmaceuticals, through ethical marketing practices, they are also not allowed to advertise. That's why the whole pharma cycle also has the whole ecosystem is dependent on the prescribers, that is the doctors, which are the prescribers. So all pharma cycle is driven by the prescribers. They are the doctors, healthcare practitioners. And same happens in hospitals also, wherein there are healthcare practitioners who are the face and the executors of whatever healthcare delivery a hospital wants to deliver. So, and doctors are not allowed to advertise. So in that scenario, how do they communicate? So that is one of the reasons that the whole this whole stream of press release, public relations, or what we call overall healthcare communications, which is the other part of healthcare advertising. It's not direct advertising. It's something which is a responsible communication, wherein there is a more like a content creation, content marketing, and content engagement is what is allowed, and that's why the press release becomes very important there. That is one of the one of the most effective way for communicating. Of course, there are other content creation and content marketing methods. For example, social media engagement on social media channels, YouTube, podcasts. These are becoming popular. So there, this whole aspect needs to be understood, and that is the only way of communicating. So one has to one has to use that carefully, responsibly, but that is a very effective way also. So that is one part of it. Second part of it, you spoke about doctors, why doctors need. So this is one of the key reasons that how, so there are in India, there are almost 14 lakhs allopathic, 12 to 14 lakhs allopathic modern medicine doctors. There are another 7-8 lakhs of Ayush doctors. So that more than 2 million healthcare practitioners in all stream of medicine. There's a big clutter. And so first part is that a doctor is the only profession, one of the profession wherein he is first of all, he's got a lot of content. He deals with patients day in and day out. Every day on an average in India, a doctor would deal with 20, 30 to 50 to up to 100 patients in a day, depending on his availability. And so he's got a lot of content because there's a lot of stories he hears, he listens, he practices. He has got all the new things coming up, any new surgery he does, any other thing, whatever. So he's got a lot of, he's full of content. That is one thing. Second is doctor is the only profession which is like an entrepreneur from day one. So for a doctor, it is like mostly if he's not working in a government hospital, then mostly it is his own entrepreneurship. Whether he has to be working in the corporate hospital, where he has to prove his worth in terms of his practice, or he's setting up his own clinic or nursing home, which he needs to grow on his own. So he's an entrepreneur from day one. That is the second part. And third part is that his whole restriction that he cannot just go and advertise. So if you put all these three combined, he's got content, he's got the need to propagate that content, and then he has got various tools of communication through which he can take forward. So this is the whole cycle how it works. So for a doctor, there's definitely a need. There's definitely a context that he has got rich repository of content. Created new contents, creating every day, every week, every month. He has got a story to tell, and he has got these mediums wherein if he uses them effectively, so he'll be able to create his own identity in a better way. He'll be able to communicate to. So doctors, healthcare practitioners have mostly two important stakeholders to deal with. One is their peers, that is their colleagues, doctors, referrals, from where they get referrals as patients. And second is their patients and their families, whom we call caregivers. So these are the two most important. And how do a doctor connect with them? Through this one. Through content creation, content marketing, through press release, PR, communication, overall these social media engagement. So these are the things how he can connect. So that's why it becomes very important for a doctor.
It's a very thought through, very well designed and a structured way of taking things and sharing it with people across, right? So since you beautifully explained the cycle and why they should consider, now please tell us what are the key elements of a press release if a healthcare professional is looking out to disseminate. What are those 2-3 elements, key elements that will create a good press release for them?
I have worked with a few thousands of doctors individually. In my initial days, I used to do a lot of press releases for doctors and hospitals. And what I learned in that journey is that first of all, what are their strengths and weaknesses? First of all, the first thing is doctor has a story in his mind, but he is not able to translate that into a proper attractive press release. One of the key reasons is that doctors come with this a lot of hangover of that I am the best, those sort of thought process. That what I am doing, I want to communicate, I am the best. So many a times they get into that trap of sort of beating their own trumpet in the press release. So that is the first thing a doctor and healthcare practitioner should avoid. Because the end objective of the press release for the readers and the viewers and for the medium, that is the health journalist or the health media, or the general media, whoever is taking it, for them it is very important to communicate a message to their readers which talks about the essence of that particular disease or particular procedure or particular how they are benefiting. So end result, so that's the biggest gap. Doctors come with the perspective that the end result should be that I am the best, and whereas the media and the people and the readers are looking at the perspective that what is useful for me in that. So that is one of the biggest gap which I think needs to be, and that is the golden formula. A doctor, healthcare practitioner understands this basic aspect. That end of the day, the communication, the content, and how it is packaged and how it is written should be consumer reader friendly. Talking about, suppose if you are talking about say any type of cancer, multiple myeloma, you are talking about any type of tumor, you are talking about any type of eye disease, any treatment. So the whole objective should be to be able to communicate about that technical aspects of that and how a reader can benefit from that information. Rather than saying that I am Dr. X and I am the best eye surgeon. So that is something that gap happens, and that's where a lot of press releases they fail, they flop, they are not able to fly with the media, and the end result is like, and that's how a lot of media have built up a perception that doctors' press releases are many a times not what they want it should be, so many a times it goes into the trash. So this is the mantra, I would say. To do a good press release and to get a good media attention and coverage around it.
Right. So when we are considering how these press releases, they are structured, done by experienced professionals, very to the point, consumer friendly, how are they different from general PR article or a marketing article or a paid promotional article?
The press release can, again, we can divide it into two parts. One is the business press release, wherein you talk about any business announcement. Even for a hospital, that a hospital has raised this much of investment, has going to invest this much to expand, open a new hospital somewhere, open a chain of hospitals, or acquiring any other hospital, or acquired this particular technology, invested in cancer care, building a cancer care hospital. So all those are mostly business procedures. Wherein there is a pure announcement, as the brands do, as FMCG companies do, or any other brand would do, or any other corporate would do, would be mostly in terms of their announcement of what they are doing. In terms of business investment, business expansion, business growth, that is the business process. Now the other aspects which people don't understand, in India, we have been fortunate to be a part of that evolution journey, wherein we said that there is a larger aspect of which deals with the patient education and health awareness, or what we call, more technically we call it health information therapy. So scientifically, if you see, it's the health information therapy, wherein there is a communication between a healthcare provider and the patients and the families and caregivers, or overall public at large. And that communication is filled by these press releases, which are more health information press releases than any business announcements. Those are more technical. You have to be more very careful in terms of what the heading is. It should not be promotive in nature. That is the first thing, that you cannot start with a paragraph or a heading about promoting your doctor or promoting your specialty or promoting your hospital. It should talk about the problem and the solution. This is how you should do it. That there is a problem of say for example, multiple myeloma or gastrointestinal liver cancer or fatty livers are growing is a problem. Then there is a solution, that how you can prevent fatty liver, or how you can get a proper treatment done, what type of medicines can work, what type of therapies will work for fatty liver. And then last aspect, while we are talking about it, it should be supplemented with some expert quotes. So here the experts are mostly the doctors. So the healthcare practitioner who is an expert of that field. So if you're talking about fatty liver, there is an expert who's a gastroenterologist or a fatty liver specialist. If you're talking about cancer, then if you're talking about any surgical procedure, there is a medical oncologist who is an expert. If you're talking about medical management, chemotherapy sort of, or general cancer, then there is a a medical oncologist. If you're talking about any radiation, linear, X-knife, gamma knife sort of intervention, then the expert is the radiation oncologist.
Right.
So you have to go up to those details in terms of understanding that who are the experts of that subject. Those subject matter experts, when they are quoted in that press release, it increases the credibility of the press release phenomenally, and that's what media and everybody is expecting, and that creates a big impact. That this expert is saying this to be done, so people believe that.
Right. So you mentioned media expectations also. So when we are sharing these press releases to the media houses or the media outlets, what is exactly that they are looking for, that they should be there in the press release?
So you have to understand the objective of the media. See, objective of the media is always their consumers. Their consumers are the readers.
Right.
Yeah. So there, any content they look at, and suppose, so in media also you can divide into, say, a general business page, or a health page, or a generic city page. So health page or city page, media always looks at some sort of talking about disease, new treatment, new type of disease, new trends which are coming up in terms of fatty liver disease are growing, child diabetes are growing, or these sort of, or anything related to this sort of pollution, or this sort of pollution related diseases are growing. These sort of food adulterations are creating these problems. So these are the sort of inside they look at, and they look at that content, the whole piece of content which you call press release, to come in a way which covers the problem, talks about the problem, which talks about the solution, which talks about the expert quotes, and which talks about some conclusion that if our readers do this, follow this in this way, they will benefit out of it. So they are looking at any messages which benefit their readers in some way. That is what primarily they are
looking for. So we've spoken about the doctor side of it, we've spoken the media house side of it. Now coming to AI, which is the real buzzword in today's world. So when we come to, and you are also working on a product called Humeta, wherein you are creating that content stream and streamlining things for the doctors and healthcare professionals, how can AI be a friend, or it can bridge the gap, I would say, when it comes to content creation or press release creation? How can that help, and how can that act as a friend when we talk about the generic AI tools that people use nowadays to a very specialized tool like Humeta, and how it can add value to this whole press release creation activity?
So basically, when we started this whole concept of Health Presso and then Humeta AI came, so I'll give a little background. So Health Presso was started with a concept that we create a platform, automated platform for the doctors, SCPs and health providers, through which they can create content as well as distribute content. That was the basis of it. Then we realized that we have to use technology deeper in terms of creation of the content. And I remember 1.5 years back, about more than a year back, this whole concept of AI was getting popular because of ChatGPT. It's all history now. So many AI have come. We even forgotten to make some specific names. So there are AI tools for different use cases. So something for content creation, for writing, for designing, for everything. There's images,
for grammar,
for everything. There's a different. So it has become. So in just 1 year, you have seen that expanding and blowing off in a big way. And we wanted to write that journey and see how how we can use AI in solving this problem. So that's how the whole concept of Humeta came about 1.5 years back. About 6 months we did a research on it. That how can we create a very specific AI tool which solves the problem. What is the problem? Problem is that, say for example, a healthcare practitioner or a doctor. He has a lot of content, he can give a lot of prompts, but he doesn't know how to write that in the way it is required for him to showcase. So that is where the gap was. So we said that, okay, can we create it, like for example, we take the first thing, press release. So we created SOPs for a press release. In that AI, we took about, so 2 things we did. So one is that we said we train, so ChatGPT is very generic. Can we train our AI tool, which we now call it Humeta.ai, is proprietary tool and patent pending, and it is can be trained on a lot of health data and content so that it's able to become a more specialist GPT, a health communication specialist GPT. So we train almost more than 2 million data we have already trained, and it is all sort of verified, validated sources globally, all the top journals, all the top data points from across the world to India, everywhere, research institutes. So we trained that AI on that. We trained the RAG of that AI on those data points. So we took about 1 year to sort of get trained, and then we said that okay, now when we give prompt, so it is coming, the content which is coming, it is first of all more specialist in terms of having that whole healthcare tonality. That it is what you do put on ChatGPT and what you put on Humeta.ai. So you can see that difference. That is one. Second is that it has got the right kind of data points, and everywhere it gives sources, because health articles mostly there should be some reference to the sources from where you take the data. So we achieved that part, that RAG, and that training is continuous. Like say OpenAI has been training for last 5 years, they keep training for next 50 years. So that is same with us, that we have started training, 1 year we have done, we keep training and it will keep upgrading. So that training will keep happening. So that makes it very real time also. Anything, suppose in any breakthrough in diabetes management, any study comes. So any study for last 72 years, it will pick up. So it is very real time. Yeah. So that is one of the biggest difference. So you get a fresh article with the health tonality, with the data points. Even if you want to doctor course, it will pick up the relevant course. That is one part of it. Yeah. So that is the part of the training and how a prompt works, a prompt engineering works. A prompt goes and a proper that content comes out. Second part is that okay, how do we structure it better in terms of needs? So a doctor, healthcare practitioner, or a health brand would have multiple needs. So one is the press release, second is authored article, third is blog, yeah. Fourth is any research article or white paper, yeah, and or any medical journal article. Fifth is in form of any script for video, script for podcast, yeah, and then sixth and most important is for various social media channels. So what a doctor or anybody for that matter would put on Facebook, the content will be different, the way it is put. The content for Twitter will be very different, like everybody knows, less than 50 words. Yeah, Facebook can be more extensive, maybe a video added to it. Insta has more image oriented, very small description. LinkedIn is more professional outlook, written in a very different way, even if we write our own content. So we write in different ways for different
Right.
So we said, can we train? Now this RAG is built up, the authenticity is there, credibility is there, validated content is coming out, accuracy is almost 99%, more than 99%.
Okay.
Can we train this on various SOPs? So that's what we did. Our press release SOP is doing fantastically well. We have tested it. Press releases are coming out in a perfect way. The way the headline should be written, the intro should be written, the centerpiece should be written, the conclusion should be written, and then there is a whole highlighted portion of what are the key messages from this press release.
Right.
So that has now started working on author article,
Okay.
blogs. So all those SOPs are in process coming up to going up to all the social media handles. That if you want to create anything for Twitter, it will give you those in that format.
In that format.
LinkedIn, it will give in that format. Yeah.
Right.
So that has started happening. And then last over a period of time, and because it requires a lot of time and even to put a lot of investment into it, we are looking at even automating the videos.
Okay.
We can automatically create video which are very health content oriented videos, which are a doctor speaking and a lot of contents explained in a proper way, a lot of visuals taken, a lot of images taken, some video bites taken. So that is what is something which we do in a year's time.
Okay.
And of course, automating the whole podcast also.
Okay.
That you give a prompt and you can create that our Humeta can create a podcast for you.
Okay.
Which is like same like if me and you are sitting and discussing, there's a whole recording going on.
Right.
But some part of it, that podcast, because podcast is not more about visuals. It is about the content, how it is played.
Right.
Yeah.
Right.
So podcast is easy to do. The prompt can take and create the whole content in that form. So
Right.
that will take time. I said
That
it
will
will
take
take minimum
time.
1 year. We will
Right.
be able to reach this. So this is a journey
Right.
of training on various SOPs.
Right.
The journey has started good. The in AI tools and AI delivery, most important is your base.
Right.
That base is perfect. We have got a like the way so many specialist AIs have come. Like
Yeah.
today, people talk about medical research or general descriptive research-oriented AI tool. Then it is Perplexity
Yes.
with a lot of data.
Right.
People talk about any specialist AI tool which captures your whole essence over a period of time and start talking your language. It is cloud.
Right.
Yeah. So people talk about image creation. Then it is Copilot. So these have been
Right.
trained in a
different way.
Our Humeta is something which will come up tomorrow after 1 year. People will say, wow, any doctor, any healthcare provider, any healthcare practitioner, any health brand says that I want to have use AI for health content creation in a customized way in these ways.
Right.
And for them, Humeta.ai will be a single answer.
Okay.
They don't need to go anywhere else. That is what we want to achieve in next 1.5 years.
Right. So can the doctors currently use this particular tool, Humeta AI, and create these stream of content?
Yeah. So at least press release they can start creating.
Okay.
Authored articles they can start creating.
Right.
Over a period of time, we are just going to, in a few months' time, we'll be launching our social media.
Right.
We'll be launching our white paper, scientific writing. That is one of the things which is much more in demand.
Right.
So there's a lot of demand for scientific writing tools, for white papers, for articles, medical journal articles.
Right.
Yeah. So that is something we have started work on.
Okay.
And we'll be able to deliver very soon in next 6 months.
Okay.
Where any doctor anywhere across the world.
Right.
And remember, this becomes a global tool. It's not only for India.
India.
Because the content is almost
all doctors globally can use this content tool.
We already have started looking at how we have got our own partners in US and UAE and in Europe, and these 3 markets we have already started how we are going to test and launch in these markets.
Right. So what would be your top 3 giveaways or top 3 key takeaways, I should say, when we talk about press releases, doctors or healthcare brands or hospitals who are trying to build practice for their doctors, practicing doctors, in relation to press release, and how Humeta can enable bridge the gap between this?
So I think if you talk about giveaway, first thing is the basic thing, that nobody is a better health educator than a doctor and a healthcare practitioner or a health provider ecosystem.
Right.
Whether it is given by pharma brands, medical devices, or the hospital.
Right.
So first of all, these doctors, healthcare practitioners, and these players should understand that they are the best educators. So they should make efforts in health education.
Right.
Because I've seen a lot of doctors who are so knowledgeable and they don't take out time for coming forward to make videos or coming forward to go to talks.
Right.
They get very focused into doing only CME and scientific talks.
Right.
But there is another aspect of education of the people, the patients,
right.
the overall country.
Right.
So that's more important, because a lot of health, the biggest problem in health prevention and even in the overall healthcare ecosystem is the gap in awareness, education. That's the biggest problem. That's why a lot of patients, they don't go for prevention in early stages. A lot of people don't go for prevention in early stages. They don't know about it. So that health education aspect is very important, where all these healthcare practitioners can play the most important role. The biggest point I would like to make is they should have this conscious call to come forward in various ways, to do whatever way they should connect to people, to the public, on forums, on platforms, on their own social media channels. Now, today, because of social media, digital media, every individual in the country is a publisher himself a media. So they should use that. That is the first thing. Second is that health education, patient education, healthcare communication is a very responsible communication domain. It has to be very factually correct. So one should always look at detailed facts of what they are communicating, or even what they are reading. So factually, the whole information system in healthcare should be driven by sources and by the tools who are very responsible and who are trained.
Yeah.
That's why we created Humeta, that today, tomorrow you want a health content creation tool and you want 100, you can blindly trust something. That's why we are making all this effort in the last 1.5 years to say that okay, this you can blindly trust this tool. It is factually correct. There is no further fact checking required. It does not give misinformation, disinformation, and
that's
fake
very
news.
important.
These are the, I would say, in healthcare ecosystem, misinformation, disinformation, and fake news.
Yeah.
These are the three most aspect, the dangers which are plaguing healthcare ecosystem.
Okay.
So that's why the credible resources, credible tools like Humeta or any other tool, I would say that even a lot of existing GPT that are about Perplexity and Claude and all these are all very credible tools which should be used, and a lot of fact checking should be done while publishing or talking. Even doctors should do that. So, and they should not fall into that whole trap of making false claims like first time I have done this thing, I am the first one. Rather they should focus on the whole content. That how my viewer and my patient is benefiting out of what messages. So that is my second point. Third point is that I think there should be a big collaboration, cooperation between the government agencies, between the government health ministries to the private corporate players, the government institutes. They are all working in silos, and particularly when it comes to health communication, health awareness, patient education, there should be some big collaboration. We have got one tool, there might be other tools also. And plus, most importantly, there should be some collaboration. The government has opened up a department called IEC. Nobody knows what it does. What impact. It is just about advertising pamphlets and whatever. They take some disease-based programs and do a big part of it. But if those things are all, collaboration happens. So, because health education objective is only health education. Whoever is doing, whether corporate sector is doing, whether a private doctor is doing, government doctor is doing, government department, the state health department is doing, central health programs are doing. The IEC, the health education part is common. Like it has only one agenda, that is benefit of the patients and the people at large, that their knowledge awareness grows. So I think there we should get united and work in a more collaborative way to create a larger ecosystem, more effective ecosystem for overall healthcare communication and health education and patient awareness.
Thank you. Thank you so much, Dr. Sadi, for putting things in black and white, what a press release is, how it can help the doctors, how it can help the media personnel, and how AI can integrate in this whole scheme of things. Thank you so much for watching this video. And if you want to know more about Humeta, DM us DEMO, and the team shall reach out to you with more details on Humeta. Thank you so much for watching.
Thank you, Kanika.